G'day friends, Tony from EchoGuru here. Today I want to have a talk about the short axis views of the left ventricle, and particularly the apical level. This is a view which is really useful for looking at wall motion abnormalities at the apex, ruling out thrombus, and for having a complete echo study. I think it's a really tricky view to get well, and a lot of people make the mistake of transducer positioning when they're trying to acquire that. So let's have a look at our screen. Okay, so here we are, we're at a parasternal long axis view, and you can see I'm nicely on axis there with the ventricle opened up and a nice horizontal lie of the ventricle for the most part. It's changing a little bit as the patient's breathing, but that's fine. We can get the idea of things. If I do it straight at 90 degrees, I'm going to end up right at the mitral valve level. As I pan out laterally, we get to the papillary muscles, and I know I'm now at mid-ventricular level by definition because we've got the papillary muscles on view on the screen. Now, many people then continue on to try and get to the apex through there. We lose image quality quite a bit here, and in this instance it's because I'm losing contact with the skin from the transducer. And so if I go from mid-level back towards the apical level, you can see the image quality is degrading through there as I've lost contact with the skin surface. So I actually don't get my apical short axis from this window here. I leave it till the end when I've finished my apical views. I'm going to get the apical four-chamber on view here. And what I'm going to do to obtain the short axis view is I'm going to come up an intercostal space to foreshorten my image. We see we've got a nicely foreshortened image there. I'm a space higher and slightly more medially, heading towards a paraapical view. And I'm going to bring my tail up, and from there I can see the short axis really nicely. I'll drop the depth down just to visualize that a little better. Now this is not too comfortable for the patients because I'm sitting right on the rib there and dragging across on the rib, but we can see that really nicely in the twist of the apex, and as well as being able to see wall motion abnormalities. So that's a long way on the skin, on the chest wall, sorry, from the paraapical window where I'm imaging this through to the earlier view from the parasternal long axis. So it's probably about 2 intercostal spaces higher and a lot more medially. So my tip for the day, to obtain an apical short axis view, head to your apical four-chamber, come up that intercostal space to foreshorten it, and then bring your tail up so you're angling the transducer inferiorly and laterally to be able to get to the apex. If you picture the heart sitting across the chest where my hand is here, it makes sense if I want to cut directly across that ventricle at the apex, that my transducer needs to be in line with that. Otherwise I'm going to lose contact with the skin. Hope you found that helpful. It's a really useful view, and one that I encourage you to really work on everybody. It's amazing what you'll find up in the apex when you actually look at it. Have a great day, and I look forward to hearing your comments and your tips for how you get the apical short axis view. Have a great one.